So in terms of coordinating with the surgical staff, it's a multiple procedure process that kind of goes on. Um, I understand there are a lot of logistics for our patients when they are getting ready to schedule a surgery. They have work, they have possibly children or home care, they've got things they need to set up for themselves. It's just as involved on the back end. Once a patient has decided to schedule a surgery, I want to go through their health history and make sure that we're getting all the lab testing that's required, that we are familiar with any medications they might be taking. I communicate all of this to not just the surgical nurse, but to the anesthesiologist as well. We want to make sure that everybody is on the same page with the patient's care. In terms of their procedures, I want to make sure that they have all of the information they need well in advance of their surgery. For example, we'll schedule a preoperative appointment 6 weeks before their actual surgery date, which might seem kind of far out. But if I have to coordinate a lot of lab testing, I want to make sure that we have plenty of time to get everything that we need in line for them. Plus, I'm going to schedule time for them at the surgery center. I'm going to schedule the surgical team. I'm going to make sure the anesthesiologist is available. I want to make sure that they have everything that they need. Their postoperative care instructions are all sent to them in advance, so they have plenty of time to review all of that information and all of the consent forms before they come for their preoperative appointment. I feel like giving them this information well in advance gives them plenty of time to go through this when they are comfortable, when they are calm, when they're in a place in their head where they can review everything and it makes sense, instead of trying to rush through this huge document in a 45-minute appointment. In terms of scheduling the surgeries, once we have agreed on a date, I book that appointment for that patient and that date is guaranteed to them. I do not give it to another patient if they've already put their deposit down on it. Then we will schedule pre and post-op appointments around that and any follow-up care. And as I mentioned, we do offer 6 months of follow-up care. So we're going to be seeing our patients about every 6 to 8 weeks after a surgical procedure for up to 6 months. The patients are always informed of what medications they're going to be taking, what surgical first aid supplies they might need to have on hand, what protocols they're going to need to follow once they get home. We want to set them up for the most amount of success they can possibly have. So there's a lot of information that they get in advance of this preoperative appointment that we have them go through. So I think that we are really competent at coordinating everything in terms of medications, in terms of pre and post-operative care, conversations with the doctor to make sure we have the anesthesiologist talk to them, the surgical nurse calls. So they kind of get to talk and touch everybody on the team before their surgery day.